On June 13th, and this is Walter. And Walter is a health professional. He's a chiropractor, and a good one. And Walter, would you share with the viewers what you came to see me for?
Well, originally my knees were so bad that I could hardly, when I drive away, I'd get out of the car and it would be like 50 steps before I could walk almost normally again. Everything was so stiff and tight. And I had hyperflexed my old arthritic knees, slipping on the ice, and it just wasn't getting better. And so Dr. Rowan called me up one day to ask me about something, and he told me what he did, and I thought that sounded pretty good. Maybe I'll go down and try that out. And so I did, and it's the best thing I ever did. Very first injection was like, I knew it was the right thing to do. I stood up and the knees were better, and they just got better. After about 4 months, well, I started off pretty consistently at first, like once a week, and then once every 2 weeks. And after a couple months, then I was about once a month for a couple of times, and then I forgot I had knees for a while and didn't come back until I went fishing for tuna off the coast at Fort Bragg, about 8 hours in a very rough ocean in a small boat. Pounded my knees to death, and the next day or 2 days later I couldn't even put any weight on my feet again. I came running back down, and one injection, and I was back working and stuff again. So now I'm getting them once a month. I come about once a month to get them injected, and we alternate with some hyaluronic acid and some human growth hormone in there, and it feels like I'm growing new cartilage in my knees. I'm not sure if that's happening, but I haven't got any x-rays to show any improvement, but it sure feels that way to me.
Well, what were your x-rays like before you came? How bad was the degeneration?
I had them taken to come see you. I had them take the x-rays, and I showed them to an orthopedic surgeon up in Willits after my tuna fishing trip, and he glanced at them like about that long and said, "You need 2 total knee replacements," just from looking at the x-rays. There's a lot of calcification of the meniscus in the left knee, and that's when I'd had arthroscopy done on it before to clean it up, because there was an old bucket handle tear in there.
Did the arthroscopy help?
Oh yeah.
Okay.
Yes, my left knee was my good knee.
Mm-hmm.
It was the right knee that was bothering me most. That was an old, back in 1975, they did a scope on it and said I had osteoarthritis on the end of the femur, and there was nothing they could do for me. When it got bad enough, they would gladly give me a total knee. And I did all kinds of stuff, glucosamine and fish oil for damn near 30 years. I've been taking that stuff, and using it, use it or lose it, I thought, and good chiropractic care on it and everything else. I was doing pretty good until I slipped on the ice and hyperflexed it, and that was miserable for about a year, and it just wasn't getting better. And
from your perspective as a health professional, you can read x-rays.
Yeah.
I know the orthopedic surgeon was ready to replace your knees on the spot.
Right.
What was your reading on those knees?
Well, I thought that they looked like there was a lot of loss of cartilage, and a lot of joint space lost.
Yeah, my reading was that you had highly advanced degenerative joint disease,
Mm-hmm.
and very highly advanced. Would you agree with that?
Yes, I guess I would.
Okay, and then when I saw you, there was a lot of clunking.
Mm-hmm.
And clicking in your knee, and there's been periodic effusions in your knee.
There was a lot of that stuff going on, yeah. But I've always believed, you can't see pain on an x-ray, and the x-rays looked like that before I had all the pain.
Yes.
And So I was doing a lot of stuff that was helping with the pain, and you know, I don't know, it probably wasn't, I don't know if it was reversing. I doubt if anything I was doing was reversing the degeneration or anything, but I think the ozone is, actually.
So functionally, comfort-wise, pain and functionally, how have you done in all this time?
Well, like I'd say, my knees right now are better than they've been in an awful long time, you know. Well, when I was 50, 52, 53, I was still playing basketball and
how old are you now?
softball. 63 now.
Okay.
So about since I've been out in California, they weren't bothering me real bad until I I re-injured them a couple of times, and then they flare up. You know.
I believe you told me that your knees are as good now as they have been in your memory.
Well, yeah, since I've been in California.
Since you've been
Before I started doing all that, exercise and all the good stuff for my knees, they were really bad. Back in Colorado, back in the late 70s, it was like I couldn't sit still in a car for a drive from Cheyenne to Fort Collins, which is about an hour, 45 minutes to an hour drive. I'd have to stop halfway there to get out and stretch out the knees.
And how about now? You have to drive a little more than an hour to see me. Any problem?
It doesn't bother me at all. I drove last August before I went tuna fishing. I drove straight through from Potter Valley down to L.A. to visit a family reunion, and got out of the car and everything was fine.
Are you, in terms of pain, if 10 is what you came in with and 0 is no pain at all, what do you give me?
Well, I'm somewhere between 0 and 1, I think.
Oh my.
Except for certain positions, I mean, I can't put my weight down. I can't sit on my heels. I haven't been able to do that for, like 40.
I can't even do that myself.
35 years. But I'd see Shree do it out here in the front. Oh man, yeah, I wish I could do that. But they're getting better. I can bend them a little further and keep weight on them a little bit further down.
And what about your function? If you had 0 function when you walked in the door, and I realize it wasn't 0, it might have been a 1, and 10 would be normal function, doing anything you want to do, what would you give me?
I'd say I'm about a 6.
Not bad.
Yeah.
And what would you say your function was when you walked in here on a scale of 10?
Well,
you're a chiropractor now.
You said it would be when I walked in.
In other words, with a normal person being 10, and 0 meaning you can't do much of anything.
Yeah.
What was your function?
Well, I probably was about a 5 or 6. I'm a pretty functioning kind of guy.
So, in other words, you were still functioning, you were just pushing it.
Yeah. And, I was just thinking about the other day, I'd be out in the back. I've gotten out of the pig business, but I used to be out in the back gimping and limping around doing all that pig work, loading pigs or moving them around and doing that stuff. And thinking back on it, I thought, how or why did I ever do that? It was a lot of, it hurt. They hurt, and not every day, but I'd have, the flare-ups were getting too frequent.
So what you're telling me is, you're doing what you were doing before, but now you're not having pain doing it.
Kind of like that, yeah. Well, I don't have the pigs anymore, but I did, like Saturday I got home from work and, was out weed eating and, everything else, trimming things up because, it's been raining so much and we haven't been able to get out for a while, so that it piled up. And then, so about 4.5, 5 hours of weed eating on Saturday, and then Sunday we did a 4.5 mile walk around the valley for just, just exercise.
Could you have done that a year and a half ago?
No, I'd quit walking there for a while.
Then your function is better.
Yeah, and then after that, then I got the mower out and mowing the back hillside and all that stuff, and I was on my feet all till 5:30 in the evening from like 6:30 in the morning and till 5:30 in the evening, and I was tired, and Monday I was a little dragging, but I come bouncing back, and by Monday afternoon I was just fine again.